Today we're going to talk about one form of dementia, the most common form of dementia, which is Alzheimer's dementia. The talk's going to consist of some background information on Alzheimer's, the clinical presentation, what people look like that have Alzheimer's, what they do. Then we talk about the normal brain so we can understand what happens in the Alzheimer's brain, why things go wrong. We're going to look at that both at a macroscopic and a microscopic level. And then we're going to talk about what's important for us here at a Nurse in the Family, how to care for somebody with Alzheimer's dementia. And then we're going to talk about certain treatment modalities and prevention and delay of the disease. So Alzheimer's is the most common form of dementia. There's over 100 different types of dementia. Alzheimer's is the most common form, and in this country, it affects over 5 million people. And if you think about the demographic change that's about to sweep across this country, we have 70 million baby boomers that are coming of age right now. I'm one of them, toward the tail. But the main thing that's associated with Alzheimer's dementia is age. So we're going to have a bunch of people with dementia if we don't find some cure for this in the near future. So caring for someone with dementia is going to be front and center across this country in the decades to come. So the main causes of Alzheimer's dementia are, as I said already, age and genetics. So if you have parents that have Alzheimer's, both of them, your risk goes up. It doesn't mean you're going to get it, but your risk goes up a little bit. Head trauma, anything that damages the brain early on is going to increase your risk of developing Alzheimer's dementia and increase the severity of the dementia as it occurs. And then other disease processes, things that affect the brain. We'll talk about that. There's a brain-heart sort of connection that we're going to discuss. So when I am training our caregivers on treating Alzheimer's dementia, we talk about the 3 stages, early, mid, and late stage, and we treat people with those stages of dementia differently. Initially, you might have trouble finding the right words. Like you might want the sugar, but you ask for the salt. So and you might have difficulty finding where you left your keys. Now those things happen to me all the time. It doesn't mean I have dementia, but if those are one of the things you might notice in a loved one or yourself, if you're beginning to get Alzheimer's dementia. And repeating the same question, that's called perseverating. So if you ask, what happened to Joe, and then you tell them what happened to Joe, and then you ask what happened to Joe again, that's called perseverating. That's kind of a sign of early or early mid-stage dementia. In this stage, long-term memory is intact. So what did you have for breakfast? I have no idea. Tell me about your wedding 20 years ago. Great detail. Okay, so that's one of the characteristics of Alzheimer's. Now, as it gets worse and worse, you have more and more difficulty expressing yourself verbally. That's called aphasia. So you can have expressive aphasia, receptive aphasia. Receptive aphasia is when you can't really understand what people are telling you. Expressive aphasia is you can't really talk to them. And finally, toward the end, in really severe dementia, there's no communication at all of any value that takes place because the person is absolutely aphasic. And you'll have increasing difficulty with activities of daily living. Simple things like putting on a shirt, or toileting yourself, or showering yourself, dressing, feeding, and as it progresses, all of these things get worse. And that's where we come in as a Nurse in the Family. Our caregivers can go in and help with each of these areas. All right, so let's talk about what goes wrong with dementia, but first you need to understand a little bit about the normal brain. Very complex structure. There's 100 billion neurons. Those are the cells. That's the heavy lifting part of the brain. And those cells, the way they work is by communicating with other cells. So there's trillions and trillions of connections. And so this is a cartoon that shows kind of the microanatomy of the brain. This is where all thought takes place, all motor activity takes place. You have one cell that's talking to another cell. This is the cell body. This is called an axon. It's a tail that goes and communicates with one of the little arms, funny looking arms that come off of this other cell. And these little arms are called dendrites. So this is the business end. One cell talking to another cell. That's how Mozart composed his concertos and his symphonies. That's how astronauts do spacewalks. That's how you breathe. This is the basic unit, completely the basic unit. If you look at, let's go back to this part. This part right here is blown up. It looks like this. And so what this is that axon that comes off that one cell talking to another cell. And there are neurotransmitters, like you may have heard of such names as epinephrine, norepinephrine, serotonin, acetylcholine. These are all neurotransmitters. And they're formed in that cell body and transported down to this little space between one cell and the next cell, and that's called a synapse. And what happens is this one cell that wants to talk to this cell releases neurotransmitters into this cleft right here. And then they come over, they float over, and they stimulate receptors. And that activates that next cell. That's it. That's how it works. But these neurotransmitters are made way back along that axon in that cell body, and they're transported down through these guys right here called microtubules. And this is kind of the meat of where Alzheimer's affects the brain. So these microtubules, you can kind of see this is an electron micrograph of a microtubule. So it's a structure, which is just a tube. It's a garden hose, but it's microscopic, transporting these neurotransmitters down here where they're encased in these vesicles, and these vesicles release the neurotransmitters into this cleft called the synapse, stimulating receptors over in the cell. So that's the microscopic part of the brain. Normal brain. Let's go back up to the macroscopic. You cut the brain down the middle like this, and you'll see there's this complex kind of, looks like snakes or noodles on top. That's where all higher functioning takes place. You got this part, that's called the cortex. This part right here called the cerebellum, that's kind of where balance takes place. And this part right here called the brainstem. And then on the cortex, that's where all high functioning takes place. You can divide that into different lobes. Temporal lobe, occipital lobe, parietal lobe, frontal lobe. And each of those has their own functions as well. And the reason you should know this is because wherever the Alzheimer's disease is attacking the brain, that's the segment that's going to be affected. So, as I said, cortex is higher function. Brainstem, which is this part right here, is breathing, sleeping, basic reptilian functions. And then the cerebellum is balance and coordination. That's that part right there. The lobes of the brain are very fascinating. The frontal lobe, right here in front, is like emotions and problem solving, and also like motor function. For example, this strip right here is right here is how I move my arm. Over across here is how I move my legs. This is where movement comes from. This motor strip with the frontal lobe. Parietal lobe has to do with sensation and like knowing where your body is in space. So for example, my mother recently had a stroke right here. And what that means is that it was on the right side of the brain, affecting her left arm. And so she can use her left arm. The motor function's intact, but she can't feel it, and she doesn't know where it is in space. Like, I can reach out and grab this table because I know where my arm is in space. She can't do that. She has no idea where her arm is in space. Back here, the occipital lobe, that's for vision. I'll give you an example from the ER. If something goes wrong in the occipital lobe, it affects your vision. I had a patient once in the ER, an older guy. He and his wife were flying the plane. He was flying the plane from Phoenix to Santa Fe. And in the middle of the air, he went blind. And his wife couldn't fly, and this guy was blind. And so she got onto the radio with air traffic control, and I don't know how they talked her down. She landed at the airport here at Santa Fe. They brought this guy to me in the ER, and he stroked out his occipital lobe. And then the temporal lobe has to do with memory and hearing and things like that. So depending on where the lesion is in Alzheimer's, that's what's going to be affected. Now we're going to talk about the pathophysiology of Alzheimer's dementia. In Alzheimer's dementia, this is the brain, normal brain on this part, all packed with all those neurons. Alzheimer's brain over here, there are holes in the brain. Whole sections of brain is dead. It starts cell at a time, and it develops into the entire section of the brain dead. Neurons aren't there. So that's one of the key aspects of Alzheimer's. You can't teach somebody with Alzheimer's new activities. You can't train them that their behavior is inappropriate. They can't learn. They don't have brain. Now, on a microscopic level, this is that microtubule you saw earlier, and this is called a tau protein. And proteins are collections of amino acids kind of put in a row. And the ribosome is the organelle in the cell that makes proteins. And what it does is it puts one amino acid onto the next one, and spits out this chain of amino acids. And as the ribosome is the protein factory, and as the amino acids come out, they fold into different shapes, into helixes or sheets. And the shape of a protein is how it has its function. It's all by shape. The tau protein is misfolded. And the tau protein is what stabilizes these microtubules. And so the lesion in Alzheimer's is bad protein folding, which causes bad microtubules, which causes cell death. Here's a cartoon that shows a normal cell. Once again, cell body. Here's some dendrites. Here's that axon coming down. And this is a disease neuron in Alzheimer's. You've got these neurofibrillary tangles, amyloid plaques, misshapen microtubules, so the axon's deteriorating, it leads to cell death. The brain dies one cell at a time, but whole chunks of brain end up getting missing. All right, caring for people with dementia. This is what we do at a Nurse and a Family. Some of the most common disease processes we take care of here is dementia. So this is Johnny taking care of one of our clients. And so when you're caring, and this is what our caregivers are trained in. When you're caring for someone with dementia, they get frustrated often by not being able to complete tasks that they have been accustomed to completing. So it's important that you have short tasks that are easily completed. For example, gardening. We're going to talk about things that soothe down. We're going to talk about the 3 S's: soothers, stressors, and signs of trouble in the next slide, I think. But this is a good example of how you can help somebody with dementia. Suppose it's very important to know what somebody did before they got sick, who they were. And so when I go do an assessment in someone's house and they have dementia, I ask their family, what did they used to do? What did they used to enjoy? Maybe they enjoyed gardening. And so someone with mid to late stage dementia, if you want to get them to do an enjoyable experience, like if they liked gardening before, then you get a pot and you get some dirt and you get some bulbs, and you may never get a plant growing there. But you have somebody with their hands in the dirt, smelling that smell, all those pleasurable experiences that used to give them joy. Now they can sense those and smell those and see those and feel those, and so they'll get a sense of joy from that, and they'll be dumping endorphins into their bloodstream. And even after the activity's over, and they've forgotten that they even did it, they'll still have the endorphins in their bloodstream. Their quality of life will be improved. And so those are the kinds of things that we do with our clients. This is I put this here to show kind of an example. Magazine pictures. If you ask somebody with dementia, so tell me what you did today, they could get very frustrated with that because they don't really remember. But one activity we like to do is you get a magazine and you see a picture of a couple people doing something, and you ask them, what do you think's going on here? And they can make up a story about it, and no one's ever wrong. You're always right. And you have a pleasurable interaction with somebody who's telling you what they think is going on in that story, in that picture. Oh, that's Jane. She's just going to the store. She's going to buy some fruit. Whatever it is, it doesn't matter. It's a story they made up in their head. It gives them pleasure to complete that story. You want to make sure that people are in low stress, low stimulus environments, because the more stimuli that they experience, the more frustrated they can get. And as I alluded to before, remember, these people are missing brain tissue. They can't learn new things. Therefore, it's our job to adapt to them. And I want to give you a couple examples of this. And for the first example is a pretty poignant one. It's a true example. There was a gentleman with Alzheimer's dementia in a memory unit. There's a lot of memory units around town. They're often locked because people with Alzheimer's tend to wander. And he was having difficulty with the staff. He was always crying, and the staff didn't know why he was crying all the time. So they called in a dementia expert who came in, and there he was in his room. He was in the corner in a fetal position, rocking and crying. And she asked him, well, what just happened just before he started to cry? What was the interaction? And the aide said, well, he does 20 times a day. He asked us where his wife is, and we reminded him that she's dead. And so he didn't remember that his wife was dead. But 20 times a day, he gets to relive that grief of his wife having died. All right? So she goes in and sits with him and rocks with him a little bit. Finally, he calms down, and he asks her, have you seen my wife? And she's like, yeah, I saw her in the garden. She's walking. She'll be here soon. Tell me about your wife. And so he brightened up and talked about his wife. That's not a lie. That is using your intelligence and knowing what this person did in their previous life and what was important to them to help them feel comfortable and calm and collected. That's not a lie. Another example that I can give you, it's another true example, was another memory unit. There was a guy who wasn't showering, he had dementia, wasn't taking a bath. It became really a health problem for everybody on the unit. And so getting people, people with dementia, having them engage in certain activities can be very stressful, like showering tends to be very stressful. But they needed to get this guy to shower. And so they remembered that he was ex-military, career military. And so they told him, hey, the general's coming for an inspection. We all have to get ship-shape. Go get a shower. He's like, okay. He went and got it showered up. So once again, that's not a lie. That's using your intelligence to adapt to their disease process to help them stay healthy. In this case, his health was in danger. The health of the other people in the unit were in danger, and he needed a shower. And you can hold this guy down and assault him and clean him, or you can help him do it on his own in a way that's reinforcing to him. So the 3 S's. We're trained about the 3 S's here to Nurse in the Family: stressors, soothers, and signs of trouble brewing. So stressors are things that you know are going to agitate your client with dementia. Soothers are things you know relax your client with dementia. For example, the gardening example I gave you earlier. We had one client with dementia at one of the assisted living facilities, and we knew that she would get agitated every afternoon around 5 p.m. That's called sundowning. It's very common in psychiatric units and memory units for people to become agitated in the afternoon. And we knew it. We knew every day at 5 o'clock she was going to get agitated. We also knew that she really enjoyed the rose garden right down the road. And so, half hour before we knew that stressor was going to happen, we took her to the rose garden so she could enjoy the rose garden. And so we introduced a soother to counteract the stressor. And signs of trouble coming are recognizing when people are starting to get agitated and introducing a soother. We have another client right now at another assisted living facility, and in his case, he really enjoys his library of movies like Casablanca. He enjoys his books, he enjoys music, he enjoys walks. Those are the soothers that we use. He hates it when people are enforcing rules, time to get dressed, time to take a shower. Those are stressors. So what we do is we introduce soothers to counteract the stressors. Stressors, soothers, signs of trouble coming. Okay, slowing or preventing Alzheimer's dementia. First thing you have to know is this is progressive and ultimately fatal disease. You don't die of Alzheimer's, but you die because you stopped eating or you get pneumonia or things like that. You can't stop Alzheimer's dementia. It's a one-way street. But you can do some things in your life now to decrease your risk of developing Alzheimer's dementia, and you can do some things in our client's life to maybe stabilize it a little bit, maybe slow it down a little bit. And the first thing is medications. So we're going to talk about medications, head trauma, the heart-brain connection, diet, social connections, and physical activity. These are all things that can help. There's only a couple classes of medications that are prescribed for people with dementia. They don't stop dementia. The best they do is slow it down. One is cholinesterase inhibitors. Acetylcholine is one of the neurotransmitters. So what cholinesterase inhibitors do is keep acetylcholine in that gap between those 2 nerve cells a little bit longer, so it stimulates the next cell a little bit more, so it increases your ability to function, increases your memory, and things like that. Glutamine regulation. Glutamine is an amino acid. It's used by neurons as well, and so this one class of medication regulates glutamine. So that's all you need to know about that. These things don't cure Alzheimer's. They don't reverse Alzheimer's. If you recall that picture of the brain with holes in it, there's no reversing that. Head trauma is quite linked to Alzheimer's dementia. Now, this is a picture of a brain striking something. So if you think about the structure of the brain, it's soft. It's like jello. So if you put it in a skull and you bounce it off something, what happens is as it hits the object, the brain kind of sloshes toward that direction and it sloshes back the other direction. So if I get hit here with a baseball bat, I will have an injury here, an injury here. It's called coup, contra coup. Because I've damaged neurons, those neurons are much more likely to be affected by Alzheimer's dementia. If I have the genetics for it, I have the age for it, and I've suffered multiple head traumas, like I used to play football or something like that, my risk of dementia goes way up. So how do you prevent that? You wear a helmet, you wear a seatbelt, simple things. You make sure you fall, so you make sure you wear good shoes. These are very simple things, but when I'm talking to our elderly people in the community that are older, I give a lot of talks like this. I just remind them, these are simple things. Stay active, because activity is protective against Alzheimer's dementia, but do it safely. Wear a helmet. If you have a little bit of dementia and now you get a brain injury, your dementia is going to be worse. Okay, heart-brain connection. There are a lot of diseases that affect the circulation in the brain. If the circulation in the brain is compromised, then that means the brain is not getting as much glucose as it needs or oxygen that it needs. And if it's already being assaulted by Alzheimer's, by those badly folded proteins, it's going to get much worse much more quickly. So if you have heart disease or high blood pressure or at risk for stroke, if you have diabetes or obesity, these are all things you can address. You can prevent stroke, you can prevent diabetes, or you can treat. If you have diabetes, make sure your blood sugar is tightly controlled. If you're obese, don't be obese. These are all things that are linked to bad circulation in the brain, which will worsen your chance of dementia, and if you get dementia, will increase the rate at which it progresses. So when you have diseases like that, make sure you see your doctor. Diet and exercise are very important as well. Some things that may be protective in terms of diet with regard to Alzheimer's are green leafy vegetables. They have the ones that are really dark skinned have antioxidant properties, so like kale and spinach and Brussels sprouts. Those are good. Dark skinned fruits, prunes, red grapes, blueberries, those are good as antioxidants as well. You're looking for low saturated fat. So bake instead of fry, and don't fry in Crisco. If you're going to fry, use olive oil for cooking. These are things that can help a little bit. And so when we go out to our client's home, we have recipes that we will use that have these kind of ingredients in them. Things that have omega-3 fatty acids like trout, salmon, halibut. These are really good for your brain as well. Some of these nuts with good fats in them. And some supplements have antioxidant effects as well, like vitamin E and C and B12 and folate. So these are supplements you can do. So if you're someone that's at an age where you might start getting dementia, if you really pay attention to your diet and really pay attention to exercise and make sure that all these other disease processes are addressed, aggressively and assertively, you can delay the onset of dementia and you can slow its progression. So this is Dr. Stephen Gundry. He's kind of a pioneer in diet. He's a cardiothoracic surgeon. And he and I have corresponded. He said that I can use this stuff as long as I give him credit. So thank you, Dr. Gundry. And so he has recipes that are particularly healthy with regard to diet control and obesity and dementia. And you go to these websites, like right here, let's see if this works. You can have these recipes and you can look up, these are all his recipes. Go to dinner, by American cuisine, by bake, and go. And here are a variety of recipes that will come up. Balsamic glazed shaved Brussels sprouts. Brussels sprouts, a green leafy vegetable. So there's your recipe. These are things that we can use in our client's home. You can put this URL on your smartphone, pull up a recipe, and there you go. You got a tasty recipe, a tasty meal for your client. Okay, social connectivity is important for delaying Alzheimer's as well. It's important for so many things. It's important for depression. It's important for your activity level. Maintain your social networks. Continue to work if you want to work. Continue to volunteer if you don't volunteer. Make sure you go ahead and play bridge with your friends. Don't isolate yourself. This has been shown to help slow the progression of dementia. And stay active. Get out and stay active. Interact with people. Physical activity is great for addressing that heart-brain connection. So physical activity will help you with obesity, will help you with your high blood pressure, will help you with your heart disease, help prevent stroke. All those things are good in preventing and slowing the progression of Alzheimer's disease. Okay, so we talked about Alzheimer's dementia, its clinical presentation. We talked about kind of the normal brain and kind of what goes wrong in Alzheimer's. We talked about interacting with someone with Alzheimer's dementia, about the 3 S's, stressors, soothers, signs of trouble coming. And we talked a little bit about the medications and some of the methods to prevent or slow the progression of the disease. Any questions? No. Thank you guys very much. We really appreciate it.